Hello, everyone, and welcome, and thank you for tuning in to Health Leaders, the place for peer-sourced and solution-focused insights for healthcare executives. My name is G. Hatfield, and I'm the nursing editor for Health Leaders. Today, we are speaking with Michele Szkolnicki, who is the Senior Vice President and Chief Nursing Officer at the Penn State Health Milton Hershey Medical Center, about workforce challenges in nursing and innovative recruitment and retention strategies and other things that can address those challenges. So, hi, Michele, how are you?
I'm doing great. How are you today?
I'm doing well. Thanks for being here. And I'm looking forward to seeing you at our workforce decision makers exchange in a couple of weeks. So let's jump right in. Obviously, nursing day to day, there's something new always for CNOs. So, what are some of the largest workforce challenges in nursing in 2024?
Well, certainly there's the issue with supply, having enough nurses, recruiting those nurses, too many young nurses in the workforce that are not benefiting from the experience of more seasoned nurses because more seasoned nurses are not staying in the workforce.
Mhm.
So it tends to be this perpetual kind of cycle that we're in.
Absolutely. And, speaking of staffing and
Mhm.
recruiting, what are some of the recruitment and retention strategies that you would recommend for CNOs to implement in their health systems?
So I think there are present things that you can do that are quite practical that everybody's doing, but then thinking about how we have to do things differently in the future.
Hmm.
So we have a several layer approach. It's not one solution is not going to bring you everything you need. So one of the things we did was lend support to our HR department by bringing in an RPO. Um, and what that did was team us with an organization who typically hires nurses for whether it be agency or other things and had them help our recruiting.
Hmm.
That helped a lot. We also started an arrangement in order to bring in international nurses, and that is a very long that's a very long runway because you're dealing with federal law,
Hmm.
H-3B visas and visa retrogression, all that kind of stuff that's been happening. So what I thought was going to be a more immediate fix is a longer term fix, but in a way that's okay because these nurses are now coming to also help to bring our staffing back to normal. Um, we tried a lot of things internally. We tried to really emphasize the what our magnet structure and our professional governance and that does for us. And
Hmm.
we redid our whole strategic planning so that the nursing strategic plan is in the hands of our professional practice council, which is our nurses that are helping to make decisions as far as how nursing is practiced in this hospital. So um, of course, we have gotten very good at bringing in GNs. We hire a lot of GNs every year, and we
Hmm.
do have an accredited program for that. So it's all of those things together that are happening in the short term. One of the
Hmm.
things that I look at very closely as well is retention. How long are people staying? And those numbers are actually looking much better
Hmm.
than they did pre COVID. But something struck me the other day, which is going to be my new center of focus. So I've not uh, gotten all oars in the water on this one,
Hmm.
but I remember being at a board meeting and they were talking about retention, and our retention has improved.
Hmm.
Um, but at one point, I said to the group, you need to remember when you're looking at nursing retention numbers that many nurses don't consider the bedside the pinnacle of their practice. They go on
Hmm.
to get master's degrees and then they become educators, they become managers like me, they maybe become nurse practitioners. We have one unit that everybody goes to before they go on to CRNA school. But I thought about that because the following week we had a nurse win a daisy, and that nurse
Hmm.
happens to be a PhD at the bedside.
Oh, wow.
And I thought to myself, I made a statement that nurses don't consider the bedside to be the pinnacle of their practice.
Hmm.
Why not? And what
Mm.
would need to change so that they would? So that's my new inspiration as far as a project is
Yeah.
concerned. What would it take? Because there is nothing like and every doctor will tell you this as well as every new nurse is trying to learn this profession. There
Hmm.
is nothing quite like an experienced nurse at the bedside and everything that they can provide for patients, for fellow nurses,
Hmm.
for those partners in care like physicians and respiratory therapists. What would it take to keep nurses at the bedside? And there's been a lot of programs with regard to this. There was our MSN at the bedside. Other people have done things. There are specialists at the bedside. But what would it take for RNs to consider the bedside to be their career pinnacle?
Hmm.
So I'm going to be exploring that more in these coming weeks and years in some of the meetings I'm attending, as well as asking our own staff, what is it that keeps you here? What is it that drives you away? Because those are the next set of circumstances that we need to change and improve.
Absolutely. And obviously, bedside nurses are critical to hospital operations. So, that, yeah, absolutely. Um, and speaking of retention, something I wanted to ask you about specifically, obviously, nurses go through a lot at the bedside.
Mhm.
So, how does workplace violence impact a nursing workforce at a health system?
It impacts it in such a fundamental way.
Hmm.
For nurses, it's traumatic. They already have a traumatic existence, right? Nurses are the emotional toll, the
Hmm.
vicarious trauma because they are feeling what their patient is feeling.
Hmm.
But on top of that, the fact that our patients and their family members sometimes attack us, maybe even physically attack us, and
Hmm.
and and it's horrible. Nurses aren't prepared for that. Health systems aren't always proactive in dealing with that. I
Hmm.
remember being on about 2 years ago, being on the jetway to an airplane, and I saw this sign, and it said, if you're mean to the flight attendant, that it's a felony. And I
Hmm.
thought to myself, and I said it out loud to the people around me, it should be a felony to treat nurses that way. So,
Yeah.
and gratefully, in a lot of states, they're passing acts to make sure that it is a felony when you would attack a nurse, physically attack a nurse. So, thank
Hmm.
goodness those laws have caught up. But not only is it traumatic on top of an already traumatic job, when you think about the vicarious trauma and the interpersonal challenges and all of that, it's almost, 70% of nurses, I think in the last survey that I saw by nurse.org, 70% of nurses go into the profession because they want to take care of people. So
Hmm.
the people you want to take care of attack you for no good reason.
Hmm.
Um, that feels like betrayal. So
Yeah.
it is a significant, and of course, safety. I mean, we all have a basic need of feeling safe where we are. So it is something that's very serious and um, requires a very disciplined and deliberate approach.
Absolutely. And, we all, like, as you're saying, we all do have a right to feel safe at work. So, what are some of the things that CNOs can do to keep their nurses safe, whether that be helping them prepare for something or, following up
Mhm.
with them after incidents? What are your thoughts?
So I think there's a lot, and the words I led off with was deliberate and disciplined approach.
Hmm.
So about 2 summers ago, I had an MHA student, and I
Hmm.
said to her, I want you to research every single thing that's out there as far as preventing violence in the workplace for nurses.
Hmm.
And we found out that there were a lot of things. ANA has something, AHA has something, ENA has something,
Hmm.
and 20 other IHI has something. There's a lot of, so everybody has a great list. None of these lists are complete. So I
Hmm.
basically said, take everything that you find and put it in a list. And let's
Hmm.
do our gap analysis using the total of ideas as what we need to get to.
Hmm.
And we used that list and started working on our process. Everything from the transparent dashboard reporting that we can basically, at any given time, I can go onto the intranet and I know how many assaults there have been.
Hmm.
Um, Everything from that to setting up things like being more proactive, behavioral contracts, having a marker in your EHR that says that somebody has been prone to violence in the past so that you can be warned to prepare for things.
Hmm.
The other thing that we did was a strong, strong connection with our security folks. We
Hmm.
consider them partners in care. We've actually given them an award that labels that. And they taught us something very fundamental. They said, really it's about disrupting the pathway to violence. What can you do, Michelle, to disrupt
Hmm.
the pathway to violence? So
Hmm.
that means being alert, being proactive and deliberate before something ever gets to physical violence. We
Hmm.
talked about notions such as verbal abuse is very often a precursor to physical abuse.
Hmm.
So you need to address those things much earlier before they result in something really bad.
Absolutely. And so, what are, you mentioned building that list. What are some systems or programs that you think should be implemented at health systems across the country to prevent workplace violence before it happens?
Well, I do think it's building that list. I think
Hmm.
that you need to have a strong incident reporting system that includes not only physical violence, but when patients or their family members commit a verbal abuse,
Hmm.
because like I said, those are precursors to physical abuse. We have systems where we have something called a silver sticker program on every single unit. Our security force has helped us to identify, for lack of a better word, safe rooms.
Mm.
One of the things that we've done was behavioral contracts. So when a patient or their family is struggling with the way they need to behave,
Hmm.
so one of the first things we'll do is like this is what we need to say, and if we don't see this, these will be the consequences of what we need to see.
Hmm.
Um, it allows you to start early in your expectations and their expectations of the hospitalization.
Hmm.
Something as simple as this. We've written a lot of those in the past. Um, but every time we write one of those, we write it from scratch. So let's take
Hmm.
all of these letters that have already been approved um, and create templates so that when it's time to bring in a behavioral contract, instead of looking at the onerous task of having to create one from staff, here's a template, keep what applies, take out what doesn't apply, and then
Hmm.
you're done, rather than not doing it because it's too big of an undertaking to have to put one of these things together.
Hmm.
So there's a lot you can do to put those kinds of protective functions into place. Staff training, as far as not only the things that you might see for violence prevention, such as what to do when you're in a certain sort of hold, but also what to do to de-escalate a situation long before it gets to that point. So, like I let off, the deliberateness of what you do, and kind of always having that preactive, prepared approach.
Absolutely. And obviously, nurses have to recover after workplace violence
Mhm.
occurs and everything. And so does the whole community, really. So, what are some tips that you have for CNOs who want to help nurses after incidents and also promote wellness in general in their organizations?
Well, we've done a program I'm very proud of is we now employ two staff-facing chaplains. So
Mm.
all hospitals have chaplaincy in their ranks, to help the families deal with various things.
Hmm.
But who is helping the nurses deal with what they experience, whether it be a violent or whether it be a death on a unit of somebody that they've been trying to. There's that trauma too. They're
Hmm.
losing patients that they become close to and caring for them, and then they lose them. So it's not just violent. It's not just violence that we need to help our staff to cope with and to overcome. It's all of those traumatic things that can happen from working on a floor and working with patients in an inpatient unit.
Hmm.
And the staff facing chaplains, and we have a few staff facing facility dogs too. So these are not the patient dogs, these are the staff's dogs that
Hmm.
have been incredibly helpful as far as basically giving staff a place and and a creature to hug as
Hmm.
far as trying to process a situation. Something
Hmm.
else we did was very recently we created what we call it the Zen Den. It's a room where staff can go so that they can decompress.
Hmm.
um, we have another thing that we do. It's called stress first aid.
Mhm.
It is a system that we adopted from use in military. So it's basically staff on staff support and protection. So it's
Mhm.
basically green, yellow, orange, red.
Mhm.
And each of those areas, you ask a staff member, where are you? And
Mm.
then on that tool, it has what that person who asked that question can help that staff member do. So if somebody says, I'm in yellow, there's things that you can point that staff member to help them recover from that state so they can
Mm.
get back to grade. Or
Mhm.
if they are orange, or if they're red. And you can imagine that it's a stronger and stronger list of um, initiatives or tactics that you can
Mhm.
point that patient towards in order to help them to recover. And it's really pointing them towards the resources that might be helpful for them to do.
Mhm.
Um, the only reason why I'm able to bring out a number of things, though, is that it was that effort of gather everything that's out there and develop your deliberate approach. One thing isn't
Absolutely.
going to do it.
Mhm.
Hiring a couple staff chaplains wasn't enough.
Mhm.
Opening a Zen den wasn't enough.
Mhm.
It's all
Mhm.
of those things and the deliberate interaction of all of those and how you pull on them in order to help your staff.
Absolutely. Well, personally, I'd like to thank the dogs. I feel like they probably, did the most there.
They seem to always be golden retrievers, by the way, so
Oh,
we seem to have a
yes.
lot of hair.
Yeah, absolutely. Yeah, you gotta get a
Mhm.
Roomba too. Alrighty. Well, thank you so much, Michelle, for your time. I'm really grateful to have had this opportunity to get to know you a little better and hear your insights. And thank you so much to our audience for listening.
Thank you so much. I'm really passionate about this work that we're doing, and the ability to share it is just means so much to me as well.
Absolutely. Well, anytime. Thank you, Michelle.
Thank you.